James Zheng from UT Health, and he'll be speaking on explainable deep learning approaches to predict development of brain metastasis in patients with lung cancer using electronic health records.
Thank you very much. Thank you for the opportunity to present our work at the conference. And this is a great conference for the community, and I really appreciate the opportunity. So my name is James Zheng. I'm a professor in the School of Biomedical Informatics. I'm also running the Data Science and Informatics School for Cancer Research. This is one of the projects we have doing in collaboration with the people in our school. Basically, in this work, we try to employ the explainable deep learning methods to predict brain metastasis risk in lung cancer patients from EHR. There are more than 200,000 lung cancer cases per year in the United States. So it's a very prevalent cancer. And also, the consequence of cancer is that it's very easy to develop a brain metastasis. So there are about 10 to 36% of lung cancer patients that will develop brain metastasis. The lung cancer cells will migrate to the brain, and then it will grow in the brain. And 87.7% of brain metastasis cases are from cancer. So you can get it's a very significant problem. And the average survival patients with brain metastasis is less than 6 months. You can see at the bottom that compared to other cancer, the lung cancer, the number of cases is way more than the other cancer types like breast and those for the brain metastasis. The bottom two are small cell lung cancer and the non-small cell lung cancer. So those two categories you can see have way more cases for brain metastasis. Examples in Kentucky and in Alberta. So the early detection of brain metastasis is very important because when the cancer cells migrate to the brain, it's more early stage. It's easy to develop treatment that has a very little impact or side effect for the patients. The idea then is, how to develop methods for early detection of brain metastasis. Typically in clinics, people use like imaging and other methods. But obviously, for early stage metastasis, the tumors it's hard to detect. So what we try to do is we try to take large core patient information from electronic health records, and then we develop deep learning model. We use the learning model to predict the metastasis risk for lung cancer patients. So in order to do that, understand the decision process is very crucial, meaning how we can take the patient information from the electronic health record, their visit information, the vitals, their medication, and lab tests, and all those information. And how can we extract useful information patterns from this electronic record data, and then effectively predict the brain metastasis for lung cancer patients? If we can do that, then we can have a machine learning model. And then if a new patient, a lung cancer patients come in without diagnosis, we can take all the electronic health records from patients, and then we feed the information into the machine learning model. We trained, and we know it can perform well, and then predict whether lung cancer patient has high brain metastasis risk or low brain metastasis risk. In addition to that, we also want to understand why this patient might have risk to develop brain metastasis. So a post-hoc attribution method for model explanation structured electron is also important for us, not only provide accurate prediction, but also some explanation about why this patient has high risk. For our project, we used commercial electronic health record database assembled by electronic health record software vendor. Basically, in this kind of database, we have patient information recorded by encounters. For each time patient to a doctor's office, that is one encounter. And then for that encounter, then we have records for patients' medication procedure, what kind of procedure the patient received, diagnosis, or event. And so then we have many encounters from these patients in the database, and we can take all these information for each encounter. We will concatenate information to a vector, and then we have a list of encounters presented a list of vectors. So how the data looks like. So in the database we're using, which is a Cernos facts database, there are total 203,504 lung cancer patients, and the information, health record information for patients are coded by ICD-9 and ICD-10. So these are the ICD-9 and ICD-10 codes we use to identify these lung cancer patients. And then we, out of these lung cancer patients, identified with brain metastases. In total, there are 26,923 patients with brain metastases. And again, we also use the brain metastasis ICD code to identify these patients. And among these patients, the lung cancer patients, there are 13,414 females and 15,300 males. So you can see that it's a balanced cohort. And if you look at the age distribution of the patients diagnosed with the brain metastasis, the average age is about 61. And you can see it's also a pretty normal distribution with regard to the age. So here's how we define the case and the control. So we start with the date of the first diagnosis of lung cancer, brain metastasis, and the brain metastasis facts. And then we label the date time of the first and final encounter, and we label the date time of hospice encounter. And that then we go through some decision to decide how we're going to categorize the positive sample and negative sample. So if brain metastasis occurred, and also if the brain metastasis diagnosis after 3 months of lung cancer, then we want to that if brain metastasis facts is not brain metastasis occurred before the brain metastasis facts. If yes, then we consider that patient as a positive sample. The reason to do that is the electronic health record is kind of, sometimes the record might not be accurate. Some patients, they are diagnosed with metastasis in one hospital, then they move to another one, and then that record was lost during this trend. So we want to make sure that our positive sample is truly the metastasis patients, where our negative sample is really patients who have not developed the brain metastasis. So on the right-hand side, that's how sure that our negative sample patients who have not developed the brain metastasis, which means, want to see the patient at least there's one have a diagnosis. We don't have any metastasis. Once we define that the positive samples, and then we also take the pictures from the patient record. We choose demographic, gender, marital status, year of birth, and also diagnosis using the ICD-10 code. Also take the medication information, use the generic name of the drug, and lab test, clinical and the surgical operations. And then we use what's called a RETAIN model. This is a deep learning model that developed by Zheng and Zheng's group for analyzing the electronic health record data. And then we use a post-hoc attribution method for explanation. And we also compare the methods we use to a logistical regression use as a so here is a RETAIN model. It's a interpretable predictive model using reverse time attention mechanism. So basically, you start with records. So that's these. As I mentioned, you concatenate all the patient records for each year. So that's the medical code. And then convert that into a vector of embedding. And then we feed into the attention model to extract the information from the electronic health records. And then we finally take the learned signals and then predict the brain risk, metastasis risk of patient. So for the explanation, use a kernel for structured EHR data. So basically, this is based on a game theory to try to identify the features that that has a significant contribution to the final prediction score, or the game outcome. So basically, the Shapley value is for feature attribution, and sample the patient data for approximation, and then we feed a local surrogate model for explanation. The idea is try to identify what specific EHR code from patients that make significant contribution to the prediction, high risk of brain metastasis. So take the local data set construction for the structured EHR, identify the unique medical code for each patient, and then we mask code for sampling and replace all masked features as a background code. So doing that, we are able to achieve high score for brain metastasis prediction. So here is a comparison to other methods.
Dr. Zheng?
Yes.
Well, we're at time, so we're going to need to wrap it up in a moment
okay.
here.
Yeah. Okay. So yes. So here you can see, you know, the if we take all the data, the prediction is the AUC is 0.825, where the logistic regression is on 0.75. So you see that, you know, the deep learning model indeed have a high performance. And here, use our method, we identify these different factors that contribute to the prediction, allow us to understand why the patient has higher risk. And so here is, you know, the another comparison of the interpretation sensitivity for RETAIN model under the kernel SHAP model. So overall, we basically take this deep learning model. We can predict the brain metastasis risk in lung cancer patients, and we also can understand what might be the factors that contribute to the patient risk. I will just stop here to take any questions.
Great. Thank you very much. Just for the sake of time, I think we're going to need to move on.
Okay.
Please feel free to put your questions in the chat for Dr. Zheng.